Good afternoon, everybody. Thank you for being here. Unfortunately, we've lost two residents of Onondaga County over the last 24 hours. A female in her 90s, male in his 80s. We now have lost 199 neighbors, community members to COVID-19. Again, just want to think about them and their families and keep them in our thoughts and prayers. Looking at some testing data points, 1,487 tests in Onondaga County over the last 24 hours. Our mandate for the region is 775 tests a day. Our region reported 2,060 tests since yesterday. Hospitalization numbers, very good. 24 individuals in the hospital. It's down 4 from yesterday. Of the 24, 9 are from the memory care facility, which has been reported on, has lost many of the residents over the last few weeks. We know that essentially 15 patients are ready to return to the nursing home and or memory care facility. So really we're looking at a number of folks in the hospital right now that need day in and day out treatment related to COVID of 10. There are 4 in critical condition in the ICU, so let's please keep them in our thoughts and prayers. Looking at who is in the hospital, 20 Caucasian, 2 African American, 2 of another race. Looking at new cases, we've had 3,344 positive cases since March 16th. That's up 17 since yesterday. Of the 17 cases, 4 are from household contacts of previously confirmed cases. 2 are from a senior living facility. 3 are from travel related to Florida and Georgia. 1 is still being contact traced. 7 from community transmission. Out of the 7, we know known source of 5 of the 7, so 2 unknown community transmissions. So when we look at what we've seen in the data this week, the data has been very good. And certainly when you look at our 7-day infection rate, really the lowest it has been, and we've been saying that, 0.9% 7-day average. But to put this into context, and this is about learning how to live with the virus. This whole process, data-driven approach, the data doesn't lie. The data doesn't belong to a political party. It has no agenda. It just tells the story. And for this case, it tells the story about where we stand today in the pandemic. And 0.9 was the same infection rate on day 2 and 3 of the pandemic. So think about that. Day 2 and 3, that's where we are right now. This community should be very proud of themselves because they took wearing a mask seriously. They physically distanced. During a process, we asked even more out of the community. We asked them to voluntarily shelter in place to drive numbers down, and that worked. So we should be very proud. And once the data is here, we get to reap the rewards because we get to do things in a safe way. And we get to reopen our economy. And we get to go through our phases. And really at this point, the next part about that is welcoming college students back and opening up schools in a safe way that leads to community growth. So we'll get into all of that. When we look at our active cases, 162 active cases, really remarkable. I want to thank our health department for everything they've done. Why do we see the community spread numbers maintain as low as they are? It's because of the contact tracing they're doing, the investigating they're doing, the active cases. These are our health department working with these individuals. Again, our health department, second to none. Looking at recoveries, +8, 2,988 people have recovered. Out of our cases, 1,949 have been female, 1,395 male, 250 under 19. 636 in their 20s, 458 in their 30s, 405 in their 40s, 497 in their 50s, 391 in their 60s, 289 in their 70s, 260 in their 80s, 158 in their 90s. Some points that Dr. Gupta wanted me to make today and to remind people, you need to please wear masks, physically distance, and stay home when you're sick. Any symptoms, whether you think you have allergies, whether you think you have a little cold, summer cold, these things happen. This is how this virus tricks us. So we need you to stay at home when you're sick. Call someone you need. If you need to go to the grocery store, call a neighbor, call a family member, but we can't say that enough. Even though our caseloads are really the best they've been and continue to go in the right direction, there are examples of which folks didn't do that. And if they did do that, the numbers, the risk of the infection would be even less. To those who are choosing not to respond to calls from the health department, we will have law enforcement deliver a subpoena to your home ordering you to comply. The virus is no joke. If you get sick, we understand you need to get better, and we understand it's an inconvenience. But we have a job to do, and we have to get people in quarantine to stop the spread of this to others. If you're not going to comply, and some of our younger people now are not, don't mess around with this, okay? We'll turn it over to the law department, we'll turn it over to the sheriff, and they'll take it from there. Other counties have had to do this. We haven't had to this date. Don't put us in that position. Also, some of our more clever residents are choosing to provide inaccurate information to our staff. Again, if you're knowingly falsifying information provided to us, bad idea. Knock it off. Tell the truth. Your friends aren't going to be mad at you because they have to go into a quarantine. If they are, they're not good friends, okay? So that's the reality. This virus is still killing people in our community, and we're not going to, none of this is going to happen. It's over. So again, cooperate with our investigations. If you don't, you're going to get a subpoena, and you're going to have to. If you knowingly provide false information and we find out, that's a different type of crime. Please don't do that. So the other thing, questions have arisen about quarantine. Only our health department can release you from quarantine. Your doctor cannot. Negative results from a test cannot. Only the health department can. Work with us. Again, our active cases are very low now. Our health department knows how to do this, and they will be in touch with you. We've heard a lot about the school reopening plans. The reality is, as a community, this is very important. And when we're trying to respond as a community and recover, and that's where we are right now. We're in recovery, economic recovery. The community fabric is recovering now from this pandemic. Why we can even have this conversation is because the data tells us we can. Not me, not the governor, not anyone else, the data. And so what the governor's metrics put forward a plan. I think they had till today for the districts to put forward their plans. On August 1, if the infection rate was under 5%, looks very good for school to happen. The infection rate, again, 0.9. So that we've met that metric. A lot of hard work went into meeting that metric. Now we get to reap the rewards by going to the next step of living with this virus. And why can we do that? Because we can do it safely. And that's what this has all been about. If the infection rate was at 4%, you may hear my tune be a little bit different, my tone be a little bit different right now related to this. We're asking the state to look at these plans, and hopefully the state's going to look and direct schools to open, looking at the equity in education argument. It's very important that our students are receiving a good quality education, and we look at all the factors that go into this. And again, no one has ever had to do this before, so this isn't easy. And so I'm cognizant of that, but certainly I have grave concerns about some of the plans we've seen. The reality is these hybrid plans are more appropriate for an infection rate much higher. And in addition to that, nobody has answered the question, who's going to watch the kids? And we have to answer that question. And the districts specifically have that responsibility to answer that question to the residents and to us. We are in charge of the communities vulnerable in county government. Our vulnerable traditionally is our children, our elderly, our poor. During the pandemic, it's everyone. But we're very concerned about our children. Our children, many of them young, have been home by themselves too long. We all know that the end of the year economically, most children have fallen behind. Now we've gotten ourselves to a point with this virus where we can open safely and provide options to parents. We need to do that. So I'm very happy to see a couple things in these plans. One, if a parent wants to keep their child home, they should have that right. And there should be online learning opportunities for them. That's covered. Many parents don't have that luxury. And the idea that a parent will have to quit a job or leave a child home who's under the age of 14 is not acceptable. So there's questions that need to be answered. To the districts with hybrid plans, maybe that's the best approach for you to learn and for you to teach these kids. I'm not going to be the education expert, but you do owe us an answer: who's going to watch the kids and who's going to pay for it? Because right now, they're just passing the buck. Really, what it looks like is to the county government, saying, you're going to have to figure that out. Or to the parents and the taxpayers who pay the bills, you're going to have to go figure out how to watch the kids. Neither one of those is an acceptable answer. So we got work to do. We really do. And to give you an idea, the child care costs for families, right now, families who are under a certain income qualify for subsidized daycare. And most of those families have one child in daycare. One, a little one, an infant up to 4 or 5 years old. But then the kids go to school. So this is unique. That same family, if they have multiple children, now qualify for all that daycare. Who pays for that? Who's going to pay for it? The county government? Because the schools didn't want to have elementary school kids in 5 days a week? Who pays for it? These are all things that we have to work through. So these plans are our starting point. They are an incomplete. Certainly, we didn't even get into the economic ramifications of this, about getting people back to work, companies being able to compete, needing their employees at work. And we're forgetting that we've had employees now working for months and months. And we've gotten better and better and better with this virus, and that's not going to change when schools reopen. Saying that, I just wanted to, one guideline that has been, I think, misconstrued or interpreted. Schools were given various guidelines. It's very tough for all of them to meet them all. One of the things, though, is 6 feet apart with desks. If you can be within 6 feet apart on the desks in the classroom, but you do need to wear a mask. So I think that's been, a couple superintendents asked me to highlight that for their constituents, saying that in these plans, the interpretation that you have to be 6 feet apart is not accurate. You can be within 6 feet apart, but you do need to have the children wearing masks at that point. So good data. The virus is real. It's here. We've gotten to a point living with this where we need to take these next steps. We can do it safely. We're prepared and we're planning for it. But we need to look at the decisions we make, and we can't make them in vacuums. We have to, every decision we make has so many different impacts on so many different people. And we got to look at what's best for the children. Can we do this safely? I believe we can. Dr. Gupta believes we can. And then how do we do it in a way where it doesn't create a child care crisis? That's where we are now. Many of these plans will. And then how do we address that issue? And then we continue to move on. So saying that, I'll take questions.
Do you expect children to wear masks for the entire school day? Is that reasonable to ask of them?
they're going to be within 6 feet of each other in a classroom, they have to.
But that's not their decision. It would be the school that says we're going to pack you in and you have to wear a mask. Is that something to expect of those kids?
That's what the guidance is, yeah. And so will it be easy? At times will children take masks off? Not all adults listen to the mask rules, right? That's the process. If a district says, you know what, we really believe this hybrid model is the best model, okay. Who's paying for the kids' daycare? Are you? If you are, I'm cool.
Is it the school district's role, though, organically to provide daycare? They do by default, but they're to educate. If they can't watch the kids for 24 hours, it needs to fall to someone else.
Andrew, we are all in this together, okay? And every taxpayer who pays property taxes right now, many of them send me emails saying, schools are going back half-time. I don't even have kids in school. I pay taxes. I'm a business. I need my employees to come to work. Can I cut my school bill in half? Of course, the answer is no, you can't. But we are all in this together. If the district is not taking a data-driven approach to reopening, and they have other pressures that are helping force decisions, then they should have skin in the game for the child care costs, absolutely.
Mr. County Executive, some of these pressures that are coming to school districts are coming from parents and teachers who aren't there yet in their heads and in their hearts with sending children back full-time like we did last September. Given your objection to the hybrid model, what do you say to those folks?
I think the reality is, again, we've never had to do this, right? But you're talking to a parent of 3 children, and you're talking to the husband of a teacher. And I know a little bit about this. If you are a teacher that has medical conditions, you're in a different situation, right? Certain conditions. And those, the superintendents and the principals need to be innovative with that, with their staff. We need to protect the staff. At an infection rate of 0.9, we need to figure out ways to get our little people in the buildings as much as possible. The idea that high school students might not, and some of these plans might not go to school at all and distance learn is, in my opinion, a bad idea. And so I understand people are scared. Me and all of you have been going through this pandemic the whole time. Many people have gone to work every day through this. We had to fight through this. We had to learn how to live with this, and it's tough. And this is the next step. Every step we've taken, there's been a little bit of the unknown, and then we've often been surprised by the process. Remember, when we started Restart, we were up here saying it's going to be okay if the infection rate goes up a little bit. We're going to get through it, phase 1, then phase 2, then phase 3. Then we said phase 4, we're scared, we got everybody else back together again. The infection rate went down every phase. So there's a little bit of the unknown, but what's the difference with your kid going to school or going to a daycare facility? And are the employees at the daycare facility any less critical watching children than teachers? The answer is no. We're all in this together. We're dealing with the 100-year pandemic together. We can't make decisions in a vacuum that impact the community at large, the taxpayers, the parents, the businesses, the human services side of this. So we got to address some of these issues at this point.
So when families are having these conversations, like what's happening in your house, what happens at my dinner table every single night with an educator, you're guiding people to look at the infection rate and have a conversation about that rather than the emotion that's clearly driving what's on people's minds right now.
That's the only way that you can get unbiased information, is to look at the data. You hear this has become a political football at the national level, and you can't let that happen. So how do you do that? You look at the data. If the data said 4.5% infection rate and 5s go, then you got to get that infection rate down more to have a good, a good start. And so I think there's risk in everything. This virus is here, just like many other viruses. We know more about it now. We know who it attacks viciously. And we also know that one of the pleasant things about what we've learned is that it hasn't really impacted our young people, especially our very young people, to date. So we used to think in the beginning of this, if you remember this, we used to think that the kids were going to be essentially spreaders of this. And it turns out that in most of our cases we've had, especially related to younger people in the elementary age, that it hasn't been the kids who've been spreading it. They've gotten it through household contacts from parents who've brought it into the household. So it's tough. I get it's tough. But we can't have a situation where learning how to live with one public health crisis turns into another public health crisis because we have kids without parents at home all day and home alone. That's illegal. That's against the law. You can't do that. That's not an answer. That's not an okay answer. Or we have parents who have to quit their jobs to go watch their kids. These aren't good. These aren't good answers. So we need to find solutions. And I think we really asked the districts to try to keep the elementary school age kids in the buildings 5 days a week if they could, and show us what are the roadblocks that stop you from getting there. One of the roadblocks was this interpretation about desks being 6 feet apart, that they had to be 6 feet apart. I went to the highest levels of the state government having this conversation. They said, no, we gave them flexibility. It wasn't they have to be 6 feet apart. It was that they could, that's best practice. If you can't be 6 feet apart, you need to wear a mask, just like we all do if we're going to be within 6 feet of each other.
Ryan, you're not the only one that's gone to the highest levels of state government on that point. And from what I'm reading, New York State United Teachers, the biggest teachers union, has had that same discussion with the state ed department and come away with the interpretation that it does have to be 6 feet. Are you asking the state to issue something that clarifies that point and makes it
Sure.
Inarguable once?
Yeah, I think if they're having the same conversation with the same people and walking away with a different understanding, then the state needs to clarify it.
If you were building a school reopening plan under the guidelines that are out there right now, what would your plan look like?
We asked the districts to really work to try to keep the elementary age children in the buildings. Academically, that's the best. I think nobody argues with that. But in addition to that, certainly from the standpoint of having children home alone, that alleviates a lot of that pressure. And certainly from a child care standpoint of having child care slots available is a problem. And if you don't have them available or you can't afford them, what do you do then? You leave your young people home alone. You can't do that. It's against the law. So these plans on this issue need to be refined, and the districts need to really look at a continuity of child care element to this.
Can you name a district whose plan you like?
I thought ESM did a fantastic job, OCM BOCES, Jordan Elbridge. And it's funny, some of the comparable school districts, like almost exactly comparable, went a different direction. They should all look at these plans. You know, I know that we've had conversations with the superintendents throughout this process. And we need to look at this from a bigger standpoint. And again, it's got to be based off of data. If data goes to the point where that infection rate's different, then everything's different. Then maybe a hybrid model is the right model. Maybe distance learning is the right model. But right now, our rate is really the best it's been since day 2 and 3 of the pandemic. And what our reinfection rate nationally, Upstate Hospital gave us the reinfection rate in Onondaga County, meaning you get COVID, and what's the percentage of individuals that you pass it on to? Our reinfection rate, I believe, is 0.88, and I think Upstate Hospital told us today that's, if not the best in the country, in the top 3 in the whole country. So that's something, again, the medical community in this has done a great job. Our health department's done a great job. That's allowed us to be here, so we can't create another crisis when the data is this good.
ESM has a hybrid option in its plan.
A hybrid, in my opinion, Andrew, is if the parents want to keep their kids home, they keep them home. ESM has their kids going K through 8 full day, 5 days a week. So that's if you don't have the ability to do that with the high school, you're not necessarily creating a child care crisis for a 15-year-old to be home alone. Distance learning. Is it best? No. But you're not creating a child care crisis.
So like CNS High School, which I think is the largest building because the city high schools are smaller, even though the city overall has more kids, you're not arguing that high schools go every day because that almost seems impossible.
We asked the superintendents 2 weeks ago, please do everything you can to keep the elementary school active 5 days a week. Everything you can. If you can't, for whatever reason, tell us why you can't and let us go work with this. And we didn't get a heads up that they weren't going to do that. So they were, I get it, they're having to do something that they never had to do, but they're looking at it through their lens of their operation, not the community at large. And we can't act like that during a pandemic. We need to look at how it impacts everything. And many moms and dads are going to be impacted, many kids, and if there's certain reasons specific to your buildings or whatnot, that makes sense. But what you can't say is we can't do this because of the data. Nobody can say that. We work too hard to get here. The data says green light.
How concerned are you with the actual education from the hybrid models and the distance learning and that perspective versus the childcare perspective?
As a parent, I'm very concerned that my children are falling behind. I'll speak to it as a parent. Some of this is not the district's fault because of what they're dealing with the 100-year pandemic. That's why when we get to where we are, it's a little frustrating that we're not acknowledging where we are in this fight with this virus, and that we can take these next steps to get these things going, to try to make up some of that ground. And again, at some point down the road, if there's a second wave, and hopefully there won't be, knock on wood that there won't be, that changes things, right? And then you gotta de-densify some of the things because of a second wave. But where we are right now, we've put this community collectively together, all of us, in a position to succeed and continue to reopen to try to get our lives back.
On the reopening of Syracuse University and bringing those students back, the plans by the university are well documented, they've been well reported. But I'm curious, in your mind, if there is any way of not looking at Syracuse University coming back, parents bringing kids here, and all of that. Is there any way of looking at that as not introducing more virus into Onondaga County?
Yeah, so what we know, so their plan's pretty solid. When you look at it, you have to take a test before coming back.
Students do.
Students do. That doesn't mean that you're not going to potentially contract the virus, or it's incubating in you, right? So when they get here, especially the kids from the hot zones, my understanding is there will be another test, and they will do a 2-week quarantine. The quarantine will be fashioned with underclassmen being on campus in buildings, easier for them to police. We are working with the college related to off-campus housing. They will share information with us on who the students are. We will work with them on a team who has experience in this, making sure that these folks are in quarantine and that they get any services they need. And so that's something that we're going to be working collaboratively with. But will one of the 15,000 kids coming back in test positive? Some of them will before they even come back. Some of them potentially test positive because they picked it up in travel? Probably. But we are going to test. We're going to trace for kids coming in who test when they get here again, and they test. If they test positive, we'll very easy contact tracing because they'll have very little exposure. But that's part of our population. That's part of who we are, and they're part of our community. So we're really preparing for this, and our emergency management team is preparing for this. We're making purchases and testing equipment for rapid testing that the community is going to have and that we're going to use. So I think we're going to be as well prepared as we can for that. But sure, we'll probably get some cases. We're getting between 10 and 20 cases a day now, 0.9 infection rate. My guess is we'll still get 10 or 20 cases a day then, and some of those 10 and 20 will shift from traveling because summertime's over, and then they'll probably shift to, kids who came in from college who are coming into the community.
And just on these travel cases that you've been reporting over the last couple of weeks, if you add it up, and I'm hoping your office can get the number so I don't have to go through all the emails again, but those numbers have been generally steady. There's always two, sometimes three cases that are related to travel. I'm wondering, can you drill down on how those cases are identified? Are those people who travel here, then they start feeling ill, and then they get a test? How is that working? Who are these folks, and what's the danger level in the community with this travel-related virus cases?
So these are folks who essentially live here, and they leave the community for work or for vacation. They come back. We encourage people to get tested if you're going to be in parts of the state or the country that have seen higher infection rates. So we're glad people are getting testing. Some of them get tested and they're asymptomatic. Some of them have symptoms. So then we do the contact tracing. And for the most part, we have 554 people in quarantine, and we have 162 active cases. So I think that tells you, essentially every case you're going to have 4 people that get put in quarantine because of direct contacts. And so that's what's happening with travel. At some point, that's going to fall off a little bit. And again, the travel concerns that we've heard the state talk about, those concerns are baked into our numbers now, and it hasn't impacted us. The infection rate's still there. We've had travel cases now for a month. So the governor's right. Traveling is dangerous. Other states have higher infection rates related to that. It's baked into our 0.9%. It hasn't pushed anything upwards.
Are you aware of anyone breaking the state-ordered quarantine locally?
I'm not aware of anybody doing it. I'm sure it's happened.
One of the things that'll be important in the fall when college students come back and kids go back to school and people start moving indoors more is testing turnaround times. What would you say the average time for test results is now, and what's your goal for it to be by September 1st?
Good question. So right now, the national labs are still behind, although I'm told they're getting a couple days better now. So business days, I would still say 7 to 9 days. If you go to a test, where do you go and you get a national lab test? You're getting one at your doctor's office is most likely. The Syracuse Community Health Center has they teamed up with Quest and others. That's getting a little bit better each day as they build up capacity. Remember, the national labs are where everybody across the country is sending them.
Is that the majority?
That's not the majority. And so the majority comes via the hospitals. And so the hospitals have rapid testing capacity to a degree right now. Much of that is reserved for cases within the hospitals. They then also have testing, which is much faster, 24 to 48 hours. A lot of that is reserved for procedures, some of the nursing home mandates. But we still have, when we have cases of where we think we need to get these people tested, could be symptomatic, could have a problem, we're sending them there to get quick turnaround times now. So overall, that's where we are. We have some testing that's happening in 24 to 72 hours. We have others taking longer. Where we want to be and where we're going is the labs will eventually get better each week, but looking at the rapid testing, that there's going to be a Roche machine at Upstate in August. That should be up and running by the end of August. That's 1,000 tests per day. We have purchased a Ronix machine. We should have that in 2 weeks. That's 100 tests a day. Upstate has another Roche machine they're trying to get. That would be 3,000 tests a day. Kraus and Joe's may be updating some of their rapid testing infrastructure. We may be able to get our hands on some of the Abbott's rapid testing. Again, the rapid testing allows you to really be on top of this, quickly turn around, quarantine, contact trace, and it allows you to do things like open your economy in different ways to eliminate risk. So I think within, essentially, where are we today? Basically August 1st. By the end of the month, we'll have rapid testing probably quadrupled as far as capacity goes. And that's important. That's important when we're talking about teachers going back to school that want to get testing with quick turn times. It's important with professors. It's important with students. It's important for all of us. And so, to your point, this is a facility-driven virus at its worst. It attacks facilities, and once it gets in one, it's tough to get it out of it.
You're clearly crushing the state-mandated regional testing requirement pretty much every day now. What will that number look like when there is almost daily testing at SU and other places, and will the rapid be able to compete with that new number?
I think that number is going to go a lot higher.
Like thousands a day?
Yeah, I think so, and we need it to. We're going to welcome back in 20,000 students. We're going to have people together, right? Every time you get more people together in each phase. So opening schools isn't its own phase, but it's a big deal. You're getting teachers back together. Everybody will do a great job in physically distance. You're getting students back together. But as you do that, the way you really nip it, if there's a problem, is through the testing. And so and then the tracing. And at some point, if you have school at all when the virus is here, just like other employers, at some point there's going to be a child whose parent gets the coronavirus. And that child was at school with 15 other children. That class is going to have to go into a quarantine for a period of time. That's inevitable. That's going to happen. That's what this virus is. And so we just need to understand all this and understand where the data is, because the data really represents the risk to the public. And the data is the best it's been since day 2 of the pandemic.
On K through 12, should teachers and students be getting a test?
I think the adults should. I certainly think they should. I think some high school kids who've been very active socially, we've been encouraging them to get tested. Many of our cases it's gotten better the last week, 2 weeks with these kids. I think some of the social gatherings, I think there's a lot better mask wearing now. But I would encourage your juniors and your seniors and your sophomores to get tested. The data is really, the infection rate is very, very low with your 5-year-olds to 12-year-olds. Or that's probably even higher, 5 to 14. I mean,
We know that here because 5-year-olds are being tested in the county?
Do I know if 5-year-olds have been tested?
I'm saying that number that you're talking about, do we know that is true locally here because we're testing a substantial number of 5-year-olds?
Our infection rate based off of we've had young children get this virus. They haven't, for the most part, gotten it from each other. They've gotten it from their parents. When you look at the percentages by age of, what's the least impacted percentage of positive cases in the COVID pandemic in Onondaga County, it's certainly your younger kids.
I've been to a lot of these events with you, and I'd say your frustration perhaps with some of the phase confusion is only matched now by your frustration with the school districts. It's probably the most critical I've seen you. What do you say to the superintendents now about what they can do to get closer to what you're looking for?
Well, I think we fundamentally need to ask, outside of the equity and education argument, the logistical argument needs to be dealt with. And it's very simple. Who's going to watch the kids? So we got to answer that question. That's, we've gone through this process. Remember in the beginning when we shut down schools, I shut down schools, and we had a plan on how we were going to do it. And it was going to be over the weekend, we all met. It was going to be that Friday, schools were getting shut down. In the event we have a case, we'll shut it down that day. I think we shut it down on a Tuesday when we got our first case. But why we said that Friday was we needed a continuity of food plan in place with all the districts so that the children, where we know the only meal they get each day is in school, still get that meal. Many districts didn't have a plan in place. So everybody scrambled and we got it in place. Continuity of food, that still goes. Where these kids, when they're home and it's your job to feed them, you get funding to feed them, how are you going to feed them? That needs to be addressed. The second piece, okay, mom has to go to work. Dad has to go to work. Our single parents have to work. Many of them work 2 jobs. Who's watching their 7-year-old for 2 or 3 days a week? What's the answer? And if you don't have an answer, well, I don't have an answer. We got to figure it out. That's
Why the frustration, though? Have you advised them this information privately in your meetings?
We expressed this very concern to the leaders in these districts, and some of them heard us and understood how this impacts, and some of them clearly didn't hear us. And this isn't a joke. You can't have little kids at home by themselves. It's against the law. So that's something that we need to address. And these plans are just plans. They've been submitted to the state. So the state needs to work with us to address this as well. Because I don't have an extra $50 million in my budget for this. We spend a lot of money on daycare. We didn't budget for this. And even in this pandemic, when we didn't budget for things, we've done it when we knew we had to because of the threat to the community. We've paid for child care for people, for essential workers, because we had to keep them in the hospitals. We had to keep our police officers and our EMS folks on the streets. Any essential employee we paid for. That wasn't budgeted, but that was based off of the risk to the community at large. Now the risk to the community at large is much less. And so we need to acknowledge that in our planning process moving forward. So I don't think it's my job as the county executive to have to figure out child care plans for all these kids. I think the districts are creating a ripple effect and an impact on families with their plan. They need to now address this in their plan.
And you communicated this to them and now feel disregarded.
Yeah, I don't think some of them didn't take it that serious.
Ryan, on a personal note, you brought her up, so I'll bring it up. Your wife is a teacher. There's going to be a lot of teachers watching this. Can you talk about the conversations you've had, not as the county executive, but as the husband of a teacher? What she has, the arc, if it is an arc, where she's at right now in her head and in her heart?
Yeah, I think teachers, and I get that perspective from Kate, and it's really important. Overall, there's fear. There's fear, and this is a scary thing. The 100-year pandemic, we're all tired, right? Many of us are tired of being tired, but we're getting through it. And this next step, every process, when something would reopen, we would hear a lot from the employees concerned about, I'm scared. Is this safe? Is this safe? And I can say that I'm comfortable sending my own children back to school. 3 little people I love the most in this world. I think teachers, some are dying to get back, some not so much. And I think there's certainly teachers out there that have medical conditions that I think districts need to work with these teachers on. Because if you have a pre-existing medical condition, a blood disorder, various things where we know this virus could impact you harsher, no matter what your age is, then we need to figure something out for you. But at point 9, it's a green light. And so what I'm saying is the plans that have been put forward, if they believe, the districts believe, and they're the experts on education, not me. If they believe that this can get the job done, I'm with you. But you can't create another crisis at the same time doing it. You have to be part of that solution.
Have you been tested?
I've not been tested.
So these subpoenas you're going to deliver to people, how many of those are going to go out?
Hopefully none. But Dr. Gupta, for this to make my notes to talk about, means that she's having a hard time, and our team is having a hard time. And it's just kind of ridiculous if you think about it. I mean, this is just, everybody has been going through this and grinding through this. You got sick, okay? That's not, I get it. You don't want people to know, you're scared, well, I don't want my buddy in a quarantine, this or that. That's just, it's not okay. It's just not okay. I've thought about it. I put myself in that position. These are scenarios that if you get sick and you got it, the best thing for everybody's health, including your friends, is to make sure they're in a quarantine so that they're there and they limit their exposure to their loved ones. And then if they get sick, then their loved ones haven't been impacted negatively. So I don't think we've had to do this yet. Rockland County had to. I know other counties are having to do this. If we have to, we will.
And they're also getting some people giving them misinformation,
Yes.
lying to them?
Yes, lying to them.
What's the penalty for that?
I'll have to talk to the law department about that. But this is, Dr. Gupta has certain legal authority and powers. I'm sure fines are involved with that. So I don't know the exact penalty to that, but I know that subpoenas have been issued throughout other parts of the state, ordering you to comply. If you don't comply, it becomes a legal issue and you can get yourself in some trouble.
Do you know your briefing schedule for next week?
I think we'll go back to Monday and Thursday next week. Everybody good with that?
Do we have a choice?
No. we spent a lot of time together.
What have
Michael.
you guys talked about, in the regional calls this week?
So we've talked about the same things we did today, and a big thing is why do we do all the things we do? We do them to beat this virus and to get through this crisis, and we've had a lot of success as a community. So we need to get these other industries open so that they can have a shot at making a year. So we talked about gyms a lot, and certainly we've talked about the bowling alleys, and we've talked about weddings. And today they said they've started some modeling on gyms and other industries related to potential infection rates if this happens or that happens. I would say that's probably the most information that they've been willing to share with us on this topic in a while. So I think that's positive. But our position certainly is at a 0.9 infection rate. We believe the other phase 4 businesses should be allowed to be opened with regulations. Other questions? Michael, did you have one, or we get covered?
No, it's the ultimate downer question. I feel bad ending on this. Maybe somebody has something more positive afterwards. But I keep coming back to this issue of for a teacher to decide that they are on board with going back into the classroom, it could very much be a life or death decision. I'm not talking about teachers who already have pre-existing conditions. I'm talking about just an otherwise healthy teacher who's faced with this choice, and it's unknowable, but we could have a situation where a teacher contracts the virus and dies because they went back to school. And that's a weighty, awful thing to consider. Yes, there's risk in everyday life, but this is right in your face right now.
That's true. There's risk. Right now, the infection rate on the risk is 0.9%. That same risk has been there for thousands of other employees too, and that's part of learning to live with the virus. So I understand the anxiety that folks are having, and I don't want to disregard that or seem not sensitive to that. I get it, and I get you're in a room. There could be 20 other human beings, 6 feet apart or 4 feet apart around you. What I can tell you is those little human beings, under certain demographics, have been the least likely to attain the COVID-19 virus. I can also tell you, when it comes to the loss of life, we have not lost anybody under 50 related to COVID. We did lose one person that we believe died of other reasons but had COVID. And when you look at all of our mortality cases, probably 95 to 98% of them all had pre-existing conditions, most of them being over 70 years of age. So that's the data. It doesn't mean there's not risk. That doesn't mean something can't happen. Certainly I could get COVID and I could be in that same boat, right? Any of us could. So it's balance, and we've found that balance. We've found that balance all the way through this. I think we'll find it again if my criticism of the district's plans, not so much academically, although I have my own opinions on that, but not enough to suggest I'm an expert more than they are. My criticism is the ripple effects of the plans. They were pre-warned about the ripple effects. Many of them didn't even give us a heads up about their plans before releasing them, which to me shows that they didn't really take those seriously. So now what I'm saying to them is we need continuity of care plans and continuity of food plans for the children if this is the model you're going to do. But for the teachers overall, I get it. Some of them are dying to get back, some of them aren't. I know, and I know this press conference has probably been an emotional roller coaster for them, but it's part of finding that balance and taking that step forward.
Just double checking, did you say no one under 50 had died?
We've had one death under 50 of an individual who had COVID, but we believe that that individual died of potentially other issues as well.
That was the person in his 20s?
Correct. Anything else? Thank you. Hopefully everybody will enjoy the weekend. We really appreciate the progress, 0.9%. It's amazing, and I want to thank everybody for that. Wear a mask.